Thank you for joining us tonight. We're very excited to participate in the Cambia Grove and the Reverse Pitch Day. It's being up second. We sort of know what we're doing a little bit, but we also know what to look for. So we're from a scrutiny perspective, we're in a much better position. We are a two-hospital system, EvergreenHealth. We offer a broad set of services across Northeast King County, South Snohomish County. We have a hospital in Monroe, which is about a 72-bed hospital, and we have a 318-bed hospital in Kirkland. Again, the broadest set of services from primary care, 11 primary care sites, 3 emergency rooms, urgent cares. We also have the largest home health and hospice in the Pacific North, or certainly within the Puget Sound region. And so it's a broad set of services with which we're very proud. We're also in a very much a growth mode. Our employed physician practice is about 300 at this point. It's been growing. About 4 years ago, we were at about 100. So we're acquisition mode. And so with that, you get a lot of legacy systems that you have to integrate and a lot of work that goes with that. You also have a lot of integration of culture and process, et cetera. So you know all the growing pains that go with growth. The other thing that we're significantly known for is across that employed base is a large set of specialties, and each one of them has their own clinical problems that they need to solve. And so with that, you can imagine if you have an expertise in Parkinson's or neurology, et cetera, each of those has a specific need that can create an opportunity for an entrepreneur. But I think the thing that is most important for us are the patients that we serve, and we really try and be a trusted source for healthcare solutions. And so engaging of patients is really an important part of what we do. These are the stats. This is the geography we serve. And so one of the things that's important about us in Monroe is we are public hospital districts, which means that we are owned by the taxpayers of the region we serve. And what that means, we have a publicly elected board. We also have our board meetings are open to the public, so if you ever want to attend a board meeting, you're welcome to do so. And we also have the ability to levy a small amount of tax that allows us to support programs we otherwise wouldn't be able to offer. Our experience with innovation is one that, as you would expect any large enterprise, we are from an IT perspective bound to some significant infrastructure that we have paid for, and it creates opportunity, also creates barriers. And so we are a Cerner shop for our EHR. We use Wellcentive for our population health tool. We use PeopleSoft for our enterprise resource planning tools. And so those are the cores of our IT infrastructure. And so with that, the innovation that those sorts of providers provide, those sorts is marginal at times, and at times it's very expensive. And so as we went into the innovation process last year through Cambia Grove, we said we ended up selecting a vendor, an entrepreneur that had a really cool front end for checking a patient in, and I'll let the physicians talk about it. But what was distinctive about it was we had the same sort of tool from Cerner, but it would have cost 5 to 8 times more. And so from the standpoint of our perspective, crassly, it was cheap labor, right? So we got good value for the provider, and they got a great proof point out of it. And so it was so good that we have extended that pilot into one medical office building on all the floors. So additional incremental revenue for that provider. So it was, and I'll let the team talk about the specific experience. But what's important about that is that we are not only an opportunity for revenue, but we are also teachers. You're learning our business, and it's a great opportunity to do that. So our commitment to innovation goes all the way to the board. We have a board digital health innovation committee that in which we have business leaders from across, from Microsoft and from a few other high-tech companies that are helping us form our digital future. And so they will be part of our process in selecting a vendor going forward. So even if we don't select you, we can create entrees into some of these significant purchasers and providers of technology. So.
Hi, I'm Brad Younger. I'm one of the emergency physician by training, one of the medical directors at EvergreenHealth. And I'm going to talk about our first problem statement that we identified that we wanted to focus on this year, which essentially is access to care. The way I look at it is it's sort of how can we bridge that gap between the provider and the patient to bring them closer together? So our goal with this problem statement is essentially to take a step back, let the entrepreneurs and innovators tell us what are the ways that we can innovate to bridge that gap. Now we could take it from the most concrete format and say, well, we need to bridge the gap through transportation. So are there technologies and innovation out there that can allow us to more efficiently transport patients to the hospital or to their clinic visits? And there's some technologies already out there that are sort of addressing those issues. But probably even more so, looking at how do we bring the patient to the provider. Now, we can look at that from the perspective of telemedicine, and we can look at global telemedicine solutions to really sort of focused telemedicine solutions. An example would be dermatology or something where we may have pain points in terms of subspecialty access. But it goes much further than that. So we can look at technology that would allow us to inform patients about where they are, where the providers are in relation to their home health visits, as another example. Or using and leveraging machine learning, the growing field of machine learning, to help us with referral patterns for our patient population to make sure they're going to the right places. We need efficiencies in all these kinds of areas, and we look to you, the community of entrepreneurs in healthcare, to help us figure out how to solve these pain points. But I think you can also even take a step further back, and from my perspective, technologies that connect the patient and the provider also fall into this access to care. So bridging that gap, because I think that's also part of it. And so that even opens it up even further when you talk about, well, even if the patient isn't there, but there's connectivity through medical devices that communicate with the providers and give them access to data that allows a conversation to continue between visits, between that patient and provider. So whether that's wearables or remote patient access technologies as examples, all good ways where we can start to bridge that gap, which can be huge, between the patient and the provider. And so I think that those, from the broadest sense, we're looking for any technology company with an idea that can help us shorten that gap, bridge it, and allow our patients access to our growing provider community. And so just, whether it's a concrete example like transportation, to telemedicine, to technology that allows us to monitor our patients or provide data communication between our patients and providers, we're looking to you for examples in all those spaces to help us with patient access.
Great. Any questions?
It's a very broad spectrum of problems you're stating. It's a very broad spectrum of problems you're stating. Can you go a little deeper? I mean, you're talking from anywhere from machine learning to transportation to, anything. So can you go a little deeper?
I mean, I'm sure I can. One of the goals of keeping it broad was to not we don't want someone to look at what we're talking about up here and say, I don't think I really fall into that category. I'm not going to bother applying, because in some sense, when we sit as a community of people on the who are sort of analyzing this from the Evergreen Health perspective, sometimes we don't know what we don't know. We don't really know what you're doing necessarily. We can kind of tell you from a broad perspective where our pain is. We're a growing healthcare organization, as Tom alluded to. We have lots and lots of areas where we can leverage technology to bridge that gap. So, it can be as concrete as distance. Now that we have the second hospital in Monroe, we have lots of distance, so that's an actual functional, geographic problem we deal with, to access to subspecialty care, to communication, to telehealth, all these areas, and to include machine learning. I mean, we don't have any real applications within our system that are leveraging machine learning technologies to any real degree. However, we do have, as an example would be, we have a very robust nurse helpline service, one of the largest, I'd say, in the Puget Sound area, and that's all, traditional phone calls as an example. How can you leverage technology to help patients understand where they should be going? Should you go to the emergency department, have an emergency physician? So I think in that context, should you go to urgent care? Is that problem? Can that wait 3 days and follow up with a primary care provider? And if so, how do you get to that primary care provider? Is there technology that makes sure that can happen? Or if something changes, how do you change that kind of appointment? So.
by front.
So what would be the measure of success for these initiatives? How will you measure whether whatever a startup that you choose to work with has implemented with you is successful?
From our perspective?
Yes.
Well, I mean, I think that, as Tom alluded to, a success would be us sort of coming back for more, saying, wow, this technology is really helping, the pilot worked well, and we want to expand it. So I think that if we identify a problem, decide on a startup, decide on what that solution is going to be, work with that startup to bring the technology into Evergreen Health, and at the end of that pilot say, you know, this has actually been a real success, so we're actually going to expand it out, that would be considered a success.
So I guess I'm asking the next level. So when you determine this is a success, what does that mean for that intervention to be successful? Are there economic measures, cost savings, or patient sat?
I think you could go right to the triple aim, right? So if it can lower the cost of care, if you can improve the outcome, improve the access, there are metrics around all of those that make sense to consider.
And does that mean that for your pilot, you'll be benchmarking before and after
Absolutely.
to get that kind of
Yeah,
thing?
and so we did that with the pilot we did, and we're able to show, in this case, there were some cost savings for efficiency around handling of paper.
Got it.
Can you describe 3 pain points? Where's your wide range? Where's the most red ink or biggest pain that you'd like to have solved?
You get one, I get one.
Okay. Yeah. Well, I think, you know, putting my non-administrative hat on, putting my emergency physician hat on, you know, we take all comers, we see all patients. So one of the things we're always looking about how to efficiently manage this patient population and get them to primary care and subspecialty referrals, how to effectively and efficiently do that. Because it's a difficult problem. And that comes back to patient access, really, from my perspective. A lot of times we are trying to advocate for our patients, clinicians in the emergency department, and having technology that helps us do that faster and more efficiently to save time and energy so we can see a couple more patients is the kind of thing that the end user, that the physician or the healthcare provider is going to feel is going to be appreciative of that kind of technology.
The one I would add would be as healthcare reimbursement changes to more of a value-based payment, we want to have the care provided in the most cost-effective location. And if that could be the home, that's even cheaper than it is at an urgent care or some sort of retail outlet, or a video visit is cheaper than bringing them into urgent care. So you want to find the least expensive location for care that provides the right outcome.
I understand his pain, but
Hang on.
you have red ink that shows your pain.
Not yet, because we don't have a lot of risk contracts. That's something coming that we anticipate having to assume more risk. Medicare says we'll be assuming 80% of our payments are going to have some value element to it by 2018. So that's coming. We know so we need to get in front of it.
Two
And
more
just-
questions.
Yeah, and please wait for the mic. We do live stream, so
I got one right here.
So in the broadest sense, you're suggesting anything that would improve the connection between the healthcare, between Evergreen and the patient. Do you segment patients in terms of, is there a greater problem with the casual, patient that you see once a year, or is it more at the other end of the spectrum, the chronic care patients?
So as you would expect, our spectrum is the highest 2% consume 50% of their resources, and so so that's your chronic care, are the most expensive. There is also a school of thought, though, that we need to be thinking about those people that aren't routinely ours, and we need market share. So how do we reach those people that are more casual users? So I'd say both ends of that spectrum are important for us to consider, but from a straight cost perspective, it's chronic.
in the back.
I'm setting this one out, so I'll kind of weigh in on, I think an opportunity here is for, especially considering Evergreen's service area and your critical access locations and your patients that you serve. For instance, if there's opportunities for follow-up care for surgical patients that may live in remote areas, an opportunity for them to maybe go to an area or kiosk for follow-up care rather than make that big trip back to the facility. So I think maybe setting up opportunities for remote access points for patients to have access to, I think that would be really a great need that would can help with your organization and the service areas that you guys support?
I think that's a good example of keeping the care at the least expensive location.
Hi there. I am interested in patient engagement and understand that you're asking for more technological solutions to support it. Can you say a little bit about how EvergreenHealth supports the human side of patient engagement? Because the providers would obviously have to learn to use the technology, but how that also fits in with how they interact with the patients and what that culture's like, so we know how the technology would fit with it.
I think that Dr. Lee is going to talk about patient engagement next, so maybe we'll let him speak, and then we can circle back on it if your question's not answered, because that's what he's going to be addressing that as our second problem statement. So,
Last question here.
Thanks. My question relates to the public interface with the telephone-based. Did you say it was nurses or people who take the calls from patients? Do they have any ongoing conversations with patients over time? Do you have specialized groups of people handling those incoming calls, or perhaps chasing down patients for appointments or whatever? Can you just talk a little bit more about that service that you mentioned?
well, I think from the helpline tries to help patients understand where they should go potentially with their problem, whether it's chest pain to a stubbed toe. They call in with a symptom. It's a symptom-based referral pattern to try and help patients understand what to do. That's not the only thing. We do have other avenues of patient engagement to some of the other things you're alluding to, but in regards to that specific thing, that's primarily a symptom-based referral system.
They can also, if you don't have a physician, they'll make a suggestion on where you might get a physician.
Hello, my name is Young Lee. I'm the medical director of our sports medicine clinic at EvergreenHealth. And so I'm going to be talking about our problem with patient engagement. And so any doctors in the room, any other, or healthcare practitioners? There we go. And so as you know, our reimbursement model currently is fee for service. Do you guys know what that is? Fee for service, yeah. And so we get paid at the hospital as a doctor, to be honest, no matter what we do, right? Currently, we see a patient, they come into our office, and we bill them for our time or bill them for a procedure, and currently we're getting reimbursed for that. Well, fortunately, maybe not unfortunately, that is changing, which we talked about. It's going to a outcomes-based, value-based model. So in the future, it's going to matter how our patients do after a procedure or after a treatment, and also if they received excellent service or not. So if a patient says, you know what, I went to that healthcare organization or this doctor, and I really didn't like that, and if we get a certain rating, that affects our reimbursement. So patient engagement is very important because we need to bridge that gap at this point. Unfortunately, it's very difficult to do that currently in our model. And the reason is we see many, many patients in our clinic, many, many patients in our ERs, and many, many patients in the OR. But unfortunately, right now, if we have to check up on a patient, for instance, if we have to make that phone call, that is not reimbursed. If you want to check up on a patient to say, hey, did you do those exercises that I recommended? We're not really getting paid for that. But in the future, we will, because those things matter for our patient compliance and patient outcomes, and ultimately, if a patient felt like they received personalized care or not. So for instance, I was a consumer recently. I bought this, I became married, and this was many years ago, and I finally decided I want to kick my snoring habit. So I bought this anti-snoring device off the internet. And as soon as I did, boom, something came in my email. It said, welcome to our family. And I said, wow, I'm part of your family already. That's pretty nice. And then a week later, because I haven't received my device, they said, boop, hey, by the way, family member, our product is coming your way. And then a couple days before I received the product, they said, hey, by the way, here's a link. This is what you're going to expect. These are some of the side effects that you're going to initially notice, and this is the outcomes that you're going to expect over the next 4 to 6 weeks. And I thought, I bought this little dinky little device, And I was like, this was pretty helpful for me. But unfortunately, we do all these complicated procedures, all these potential medications we prescribe that has side effects. We can't even get that information out to them in that easy manner at this point. So you can see that this is a big problem in healthcare, not just for EvergreenHealth, but healthcare at large. And so that is the problem that we have, and hopefully you'll find some solutions for us.
So are you looking for a solution for the broader base? So we're a prenatal wellness and engagement platform for families and for moms, obviously. Are you looking for something for more of a broader base, or would it be just as equal a proposition to have a more segmented target?
You know, I think we're going to be pretty open to that. So there are other programs that we're using. I don't know if you're familiar with what's called WellPepper, which is another patient engagement tool for sports medicine, orthopedics, and rehab. But I think what we're probably looking for is something broader, to be honest. And then, you know, if there's a product that you have that's more narrow, then obviously I think we could look into that.
Are you currently using any patient portals or anything in your current process?
Yes, we are using patient portals through our Cerner system, which are electronic medical records. But unfortunately, it's very clunky. And so basically right now they have to send us an email, and it goes through our assistant. Our assistant sends that message back to us. And if it's too long and we have to answer, a lot of times we don't have all day to respond to emails. So unless it's something that's simple, it's hard to get back to them. And unfortunately, the process is very clunky. It just isn't working out that well.
So earlier, Tom talked about using Wellcentive and you just talked about Cerner and some of the portals. Are you looking for something that kind of brings those pieces together, that interoperates with those services, or is there a particular population? For example, would it be the CJR population for you that you have a focus on?
I mean, part of it is potentially, but at the same time, I think depending on the value for our organization. Because like one of the products that we used before, we had potentially a product that we could use through Cerner, but because we got the better value out of this other product, we ended up going with it.
Yeah, I think no matter what, there's likely to be integration points that we have to account for. I think that's, and so I think Jack's going to talk about that as we talk about our experience with the last innovator that we talked with. But I think it's important to build around essentially your gap filling for the EHR vendors, which has value, and that's where innovation can occur.
Thanks. So is it really more about what happens between those visits and making sure things are being done at the patient home or whatever? Or is it really more about streamlining the process of, you know, understanding what's happening and being able to ask questions like, have you done your exercise, kind of more hands-on tracking?
I'd say it's anything between the visit that can improve the health of the patient and improves compliance, improves their ability to, if it requires them to ask a question in order to be more compliant, anything we can do to facilitate the work between visits.
And also part of it could be
on the patient's behalf, sorry.
Yeah, and also potentially collecting outcomes. And so how the patient is doing, that's another big part as we move forward. That could be another collection item.
So my sense is that for each of these treatments or diagnoses, you have pretty well-established guidelines for all the things that need to happen. So is this mostly about being able to automate that follow-up and the engagement with the patient that comply with the guidelines, and perhaps collect some additional data like outcomes? And my sort of related thing was that not being captured in the EMRs today?
Yeah, no, that is part of it. But also, we want patients to receive personalized care. And so we want the patients to feel like, you know what, I didn't just get this printout, which we could do, we could hand them, whatever. But we want to make it personalized for them. Like when you walk into a store where you're like, wow, I got really special attention from my healthcare provider. And that's what we're looking for.
And would that include things like shared decision-making or patient decision aids, things like that that are being...
Could.
Okay.
Are there any concerns of over communication with patients? sometimes those surveys are a little bit annoying or pestering. So, I mean, it's kind of a fine line between the amount of communication you want to have with patients. So I'm just curious to know if that is a concern of yours.
I'm not an expert at that particularly, but I think the ability to pull information at the point I need it as a patient is really interesting and helpful. So I think pulling is the most interesting part as opposed to pushing what we think they might be interested in.
But part of that is when we try to collect outcomes for some of these, it is overbearing. But unfortunately, where our future reimbursement is going, I'm sure it's going to change, but right now, they do have to fill out this long survey. And unfortunately, that's not necessarily what we're doing. That's what the insurance carriers are doing.
Thank you for doing this. My question is about the service lines related to patient engagement. Is sports medicine your focus, or are there other service lines? And I'm particularly interested in oncology in cancer patients. Is engaging cancer patients something that you're interested in as part of this problem statement?
So we would include all of our service lines, and I didn't talk about our relationship with the Seattle Cancer Care Alliance, which is a significant player in the Seattle metro market, but it's also challenging to integrate with from a data perspective. And so I think that our patients suffer as a result of that, and I think it would be a great opportunity. But I would not limit ourselves to any one service line. But if you have a great answer that's cancer specific, could be a very intriguing one. So,
would you consider using a mobile app, like a phone app or something that the patient would have on his phone all the time, and you can send notifications and they can communicate back to you through the app?
Sure. Wellpepper is an app that we use for the MSK program, and I'm a patient and I use it.
Yeah, as a EvergreenHealth app, I don't see one. So, as a EvergreenHealth visitor, you can just have something that they scan and immediately the app installs on the phone, and there you can send schedules and notifications and doctor suggestions or information about their medication, their next scheduled visit. The app can provide all of those information, right?
Is that a question, or is that
I'm just asking.
An idea?
Just an idea. Have you considered such a thing?
No, we do not have that.
So the portal is available on your phone, so you can see anything you see in the portal you can see on your phone. So that to the degree that the data you just talked about is in the portal. You can actually send an email to your physician via the portal. So there's limited elements, which Young talked about. So,
right, and so we can send them an email, but that's pretty much.
That's about it.
Yeah.
Yeah.
So speaking towards the pilot, are you looking for a small scope before implementing across region, or can you speak towards that?
I would encourage you to consider a small scope that can scale. Because I think a proof point that's within your grasp financially and within the technology you already have mastered prove yourself, and then we can talk about integration and then expansion. So.
Here in the back.
Just a brief follow-up on my earlier question. Patient engagement in part is the availability of this information between the patient and the doctor, but it's also about persuasion, getting the patient's heart and soul into the idea that this is the right treatment for them so they will take the action. And I don't know, it would be nice for those providing tools to understand how Evergreen models that interaction, or what kind of standards or what area manages the standards to deal with that soft side of patient engagement that has to complement for all this technology to work.
So we have a significant investment in patient engagement for the caregivers, so that they are able to do many of the things that you talk about: a warm welcome, a fond farewell, those sorts of things at the point of engagement. And so the question is there more content that can be persuaded in that? That's an interesting question. I think the idea is we want to make sure they've had a good experience, so that any content that's delivered is also carried through from that. So that's we invest heavily in that sort of training for our team, for physicians, et cetera. We actually have Young knows what his patient SAT scores are, and we have coaching if he doesn't do very well.
Lots of coaching.
Yeah. So, but to the degree that that can be facilitated through other sorts of mechanisms that are digitally enabled, that's interesting.
One last question.
Thanks. You touched business model, so I just want to kind of see if you can deep dive on that for a second. So you're moving from free service to, to the other model. And how do you see the opportunity when you're effectively handing over or participating in a digital program, something whereby the patient does some of those things at home? How do you think the business model that encapsulates that works out?
Business model for us or for you as the vendor?
Well, it's actually together, right?
Yeah. So for us, we're going to get paid a budget in which we're saying we're going to give you $500 a month to take care of this patient, no matter whether they're sick or not. And so what our job is to do that most cost effectively with the best outcome, because we're accountable not only for the cost but for the outcome. And so to the degree that tools can help us with that, then what we're going to want from a relationship with you as the vendor is predictable costs, reliability, integration, those things you would expect from a good vendor. But I think predictability on cost and scalability on a business model, those are the things that you would want to have.
Great. Well, thank you so much for giving us insights into the specific needs.